I was probably initially inspired by my parents because my father was a senior nurse tutor and my mother was an occupational health nurse and a flying nurse as well on the planes. And we used to take part in the St John's Ambulance kind of holiday programs back in Scotland and do first aid as part of holiday programs with my mum, and it always took my interest then. I go in and take handover from the previous shift on each client or patient that you're looking after, run through your medications for the morning, consider prioritising which patients need to be attended to first, such as diabetics will need to be attended to early, you know, they'll need their medications before their breakfast and so forth. And then also attending to family member questions or relatives. Attending to pain management, medications, any needs of your patient, making sure that both you and the patient and the team are on the same page in terms of their planned goals for their care. And then you would basically hand over to the following shift when you're ready to finish. Meeting lots of different clients from different backgrounds, gaining different skills, different knowledge, working with a team, and there is the aspect that you do have quite an adrenaline rush when you have those moments, especially when you work in intensive care or emergency, where you feel like you've really achieved a good outcome. Intensive care nurse, it's quite a challenging environment. There's an awful lot to learn, and there isn't an awful lot of space to learn it. So probably learning how to use the ventilators, learning how to wean patients, reading how to read the way they were clinically heading along with the team. By studying, hard work, continual training, because it doesn't just stop when you've qualified, you've actually got to do continuing education to maintain standards and to remain up to date and to be a safe practitioner. Who is willing to speak up when they're not sure what they're doing, someone who shows genuine empathy and care towards the client, someone who's an analytical thinker, and someone who will do their background and do their due diligence in terms of maintaining standards and knowledge. Calm thinking, analytical thinking, empathy. I think that if you have a nursing qualification behind you, there's no reason that you can't take that qualification anywhere in the world, and it would be difficult to be unemployed for a long time with that kind of qualification behind you.